Hey, I got a device here called a neck hammock. It can be really helpful for patients who are experiencing neck pain and can't find a way to get some relief. I find that this can be really helpful because it's pretty relaxing and it avoids you kind of stretching and pulling on the neck. Though it does come with instructions or videos online, but I thought it might be helpful if I show one breaking it down. So when this comes, it's got kind of a loop on it here, some adjustment straps. It's made to hang on a doorknob, okay? Depending on your doorknob, you can hook it on either side. On this particular doorknob, if I hook it here, it just kind of slips off. So I put it behind, and then I close the door and just make sure the door is pretty sturdy. From there, we want this to hang. There's some pads on there. We want these hanging towards you or further from the door. You'll play with the adjustment based on the height of your doorknob. This doorknob's a little lower than most, but regardless, we want kind of about maybe 6 to 8 inches above the ground. And again, you can adjust based on what feels good for you. But we want to get this to gently lengthen the neck without doing this. So we want to imagine that this thing is going to lengthen our neck, not extend our neck. So once that's there, on the lay down, you get this here, these pads are going to go pretty much right on the base of my skull there, okay? And then I hang out. I want you to play with some adjustment here. So you can go a little closer to the door or a little further away. I find for me, I don't know what that is, maybe 1.5 feet or so away from the wall seems to be about right. You can get a pillow for your knees if you want, because I want you to just be totally relaxed and chill here. A couple things, where you place the pads, there's maybe going to be a little personal preference and a little kind of fiddling with it. So if I place these pads too much in the middle of my neck, you can see it tilts me backwards. If I get this more up towards the base of my skull, it still feels secure, but now it provides a pull towards the door as well as up a little bit, and I'm a little more aligned. If I want a little more pull, I can scoot away from the door, so now I feel a little more pull, still pretty gentle there. So that's pretty much it. The main thing is just making sure your distance from the wall or the door and the placement of this doesn't get your head tilting backwards. And we're not going for like a crazy high lift up here, so it should feel like you're only a couple inches from the floor, but it's giving you a nice gentle pull there. And then you're just gonna relax. I typically advise at least 5 minutes, up to 10 or even a little more if you're feeling good in here, because we want enough time for the body to stop fighting it. Often when you first try this, you're trying to get comfortable, you're playing with it. Once you find kind of a comfortable zone, you're just gonna hang out. I like to, you can relax the legs, you can have a pillow under the knees if you like that. I like to just place the hands here and do some deep diaphragmatic breathing. So I'm trying to expand the abdomen, but also the lower rib cage. And as I breathe in, especially here, but in general for folks with neck pain, I want to make sure that the neck and shoulder muscles are not doing the work of my breathing. So I'm not shrugging up, I'm not using these muscles to breathe, but I'm nice and relaxed and doing some breathing lower into the abdomen and rib cage. So this can be really helpful for cervicogenic headaches, which are migraines that are originating from the neck, from a lot of different types of neck pain, whiplash, stuff like that. It's not the only tool we'll use to get you out of that pain, but can be a powerful one to break the pain cycle or to take the edge off after maybe a long day or a long time at the computer. So again, 5 to 10 minutes, should be relaxed and it should be comfortable. And so play with the settings, make sure your neck isn't extending back and see how that feels. You can play with kind of where this is on your head. Up there, that's a little too far, it feels like it's gonna slip off. So kind of right about there feels good for me. So give it a shot. These things can really, really help, even though it looks so simple.